Hi there. Today I have a special guest and team colleague, team worker, Dr. Lacina, a chiropractor that just joined our team, and I cannot wait to for people to actually try her unique abilities, that she has to make humans even better. Awesome. So I'm actually just going to share straight with our guest here how I met with Dr. Lacina and how it's interesting how things work out, right?
Sometimes, yeah, it was a little bit serendipitous.
Yes, yes, yeah. And everything that we actually think that it's a coincidence, it's actually more synchronicity. So everything happens for a good reason. So
Definitely.
yes, yeah. I met Dr. Lacina at another clinic. I think it's like 6-7 years ago.
Yeah, I think it was about like right when I was first starting my career in chiropractic.
Yes, yeah, awesome. Yeah, I was doing a Shockwave training, and it's interesting because I remember Dr. Lacina as one of the most engaged, if we call it, students at that time. And I was quite surprised with you when we did, now the training in Shockwave for you at Unpain Clinic, that you still remembered a lot of stuff since then, right?
I think I took notes. I still have the notes somewhere. They're in like a little notebook on handwritten in pen.
Well, so let's go back kind of to yeah, like what was your first, actually, I want to know, and I want to, like, our listeners want to know what was your reason, or who was your domino effect to kind of get you started in chiropractic adjustment or in this field?
Oh goodness. I have seen a chiropractor since I was little. I was treated because I had very, very bad earache pains that were, doctors thought, progressively going to lead to me being deaf in one ear.
Yeah.
And my mom took me to a chiropractor, and I started getting treated very regularly. And it's funny because I wanted to go to med school. And
Wow.
kind of went down that path a little bit, and it just constantly felt not right for me. So it's funny because I went, having this existential crisis about what I was supposed to do. I went to see my own chiropractor for an adjustment, and I poured out my sad little sob story about, I don't know if I want to be a medical doctor. And she said, why don't you be a chiropractor? And I went, okay. Where do chiropractors go to school? And so she told me a few schools to check out. And as it turns out, the Canadian school was it was like a week before their deadline to apply. So I just sort of rolled the dice and applied and ended up getting in. And I just kind of went that way.
Wow.
Yeah.
Wow. So the proof was in the pudding.
Yeah. And it had constantly felt like a struggle. Every step of trying to get into med school is a struggle.
Yeah.
And then it was just like chiropractic was just so easy.
Wow.
Yeah.
Wow. It's amazing. I personally get adjusted in regular basis, and I believe so much in chiropractic because it's this approach and this treatment that it's actually focused more on the cause and specializes more in the nervous system, like nerve roots, because if there's impingement or subluxation, or if things are not working properly, and if the communication is interrupted, then usually the body kind of suffers or has more difficulty.
That's definitely one chiropractic.
Yes.
We are definitely neuromusculoskeletal practitioners, right? And we primarily apply manual therapy to those root causes to try and give people, pain relief, better quality of life, better movement, just overall better wellness.
Yes, very true. Thank you. Yeah, it's interesting because as we initially said, it's like everything works for a reason, and even how we connected and how we actually collaborated, right? Mm-hmm. It's like since the first time that we met, like during that training, even though you weren't part of Unpain Clinic, wherever you were, working, anytime when you saw a client that you noticed that they can actually benefit from the Shockwave treatment you have sent them. So
Definitely.
Yeah.
Well, and I saw that you were doing something unique and
Yeah.
different and something that wasn't really offered by a lot of other clinics, of many disciplines. And I think I sent one person to you the first time, and
Yes.
the results that they had were so spectacular. I'm like, more people need to come. like that's it. You're kind of the guy I send my last chance sort of hopeless cases to, because I know you can help them
yes,
if
yeah,
I can't.
yes.
So,
Yeah. And this is how all practitioners, doesn't matter what they do, should collaborate. Like this is example of unique ability collaboration, because even myself, I only do one part. I fill the gap on one part, and I still need the help and collaboration with other practitioners. So yeah.
No, and I 100% agree. Like no practitioner, regardless of what discipline you're in,
Yeah.
can do everything by yourself.
Yes.
And so, you really should be trying to build a team inside your office, outside of your office, so that you can get your patients better, because that's what we're in healthcare for, right?
Exactly.
That's the priority, is always to put the patient first and make sure they're getting the best care, even if that's not from you.
Exactly. See, it's like this is when a good heart person becomes a healthcare practitioner. Like this is that combination.
I don't know. I think you might be waxing a little too poetic about these.
Honestly, it's no, that's the truth. We're only speaking the truth here, and it has been proven since we have been collaborated like directly or indirectly for the patient health. And so do you have any like personal experience or like any example how shockwave therapy helps somebody, that kind of they reach that maximum improvement with other modalities, and then the kind of the shockwave did help them?
Yes, actually.
Yeah.
It was one of the first, I think, patients I sent to you. I'm not going to name any names,
Yes,
but they were very severely injured in an accident in one of their shoulders, and they were actually completely unable to do their regular work.
Yeah.
And had been on disability, and had sort of gone back on modified work, and had very little range of motion in that shoulder. I believe they could maybe get their hand to about shoulder height in lifting. And I treated them, and they were a little bit improved, and then I sent them to you, and I think you saw them 3 times, and they were back to full overhead, full strength, and actually was able to take their original job back, because they could do the overhead work, the heavy lifting that they needed. And that was, I think, one of the catalysts for me saying, like, no, more people need to go and have this type of therapy. Like, it's so useful.
Yes, yeah. Well, yeah. I remember that plant in particular, and it's one thing actually with like what I focus personally, or what is kind of almost like the missing link that I've learned from helping people in regular basis, and what it kind of get missed sometimes, it's actually surgical scars.
Okay.
So when people have surgeries, doesn't matter, like from pretty much from the time they're born to today, anytime when there's a surgery in that area, it's another injury to the body. And then human body kind of can compensate for one dysfunction, 2, 3, but then it gets a point that it can't, and it's constantly requesting a change. And then pain becomes this, just like, okay, I need you to change what you're doing. And even though you actually treat now the recent injury, if that initial injury wasn't corrected, which is like the surgical scars and that communication, people end up in that vicious cycle, or pain kind of traveled from one area to the other.
It's interesting too, because there really isn't anything on the market or in the clinical world right now that is very good at treating those types of things, like scar tissue. And there are so many people who will get adjusted or get treated and they'll feel fine for a little while. And then all those problems come tumbling back in.
Yeah.
And we're like, what are we doing wrong? What are we not fixing? What are we not treating? And then someone like you comes in,
Yes, yes.
sees the scar, treats the scar, and then all of a sudden it's like when we adjust these people, they're now going for months without
Yes.
needing treatment.
Yeah.
And things are moving into place easier. And yeah, it's crazy. It's really interesting how that works and how something like a surgery, which we think would be beneficial, actually ends up being seen by the body as an insult.
Yes, yeah. Wow, you said it really well, actually. It's an insult, but it's like body cannot forget.
Yeah, well, I think we have memory, right?
Yeah.
So we talk about muscle memory a lot, but I think we don't necessarily talk about fascial memory.
Yes.
It's really interesting because fascia is actually more innervated than muscle.
Exactly.
It's interesting that we don't put more focus on that.
Yeah, it's becoming more popular, and practitioners and even people are know more about fascia. So this wide thin layer that pretty much covers everything in the body, from the muscles, organs, and it's this intact tissue. It's almost like a cover, right?
Yeah. Spider web or
spider web.
sausage casing.
Yeah.
It's a little gross, but it's kind of what it's like.
Exactly. And it's I heard it's about 1,000 times more innervated than a muscle. So typically when a pain comes, when a person feels the pain, it's from the fascia, not much from the muscle.
Yeah, I've heard that too.
Yeah. And honestly, this is another interesting, like talking about fascia, I read actually research that talks that even our bones are actually a fascia layers, like put together.
Interesting.
And it's like, and that's why the periosteum, the layer that covers the bone, it's very sensitive, like highly innervated.
Yeah. It's probably the most innervated and sort of most highly vascular as part of that.
Yes.
Yeah.
Wow. Yeah, we can talk about those. Like I'm trying to kind of keep us in a straight line because we've only not talking about this stuff.
We're moving into science.
We don't want to overwhelm anybody with science. Like we know the science, we have to make it simple, for people. So just to help them.
Yeah.
So this is another thing that again I wanna share with people because it's interesting. We, as a clinic, we were looking for open-minded practitioner that looks the body in very holistic way. And I was actually thinking, okay, should we post, an ad to find somebody on like typically, but I don't believe on that because a lot of people can make a lot of things up in interview process. So I'd like to kind of go a lot with my gut or like people, that we know. And you took a training recently on rapid, which is like a manual approach technique to release again chronic pain. And then they were actually featuring you there, like what Dr. Lacina is telling about rapid as an amazing, approach technique. And I took the same training, I think about a couple of weeks later. And then I said, oh my God, like the universe is telling me to contact Dr. Lacina and to see if she would be interested to join our team. And then that's the reason how I actually contacted. I say, hey, it's like, do you know anybody or do you want to come and join our team so we can actually help people with the same approach?
It honestly must have been some kind of fate because you messaged me on LinkedIn. I never checked LinkedIn. But that day, I just happened to accidentally pressed LinkedIn when I was trying to get to another app. And I'm like, oh, I have a message. So random. And then this post to me was like, wow, I haven't heard from your end in like a million years.
Yes.
And yeah, I just kind of ran with it.
Yeah.
I think it was a good choice.
It is. And this is the thing with anything, like doesn't matter what type of work every human does. It's like first, it's the heart, it's the attitude, it's the approach, and the skill comes after. So At Unpain Clinic, we constantly look actually for people that have, you know, the right heart, because here we don't look at anybody as a number. We are not looking anybody just to like number of clients. We want to help them. And we say a lot to our clients, we hope we never see you here for any problem. You know, once the care it's done, and then what happens is like they move on with life, and then we hear all kinds of stories. They come back and say, oh, I'm able now to work, I'm able to play golf, I'm able to run, I'm able to do those things for the first time in a while. And then they go and spread the word about us. And have been working for over 11 years now in Edmonton, and it's been purely based on word of mouth, like
Nice.
practitioners like you know, recommending, and then just like other people. So I'm actually very excited that we have you here now. So anybody in chronic pain that has been, you know, for more than 3 months and have tried literally everything else, now they have Dr. Lacina here, who has the experience from the manual therapy, from a chiropractic perspective, knows the body inside and out. And yes, and as far as I know you and all my experience with you so far, you really focus on the function of the body as a one unit.
Yeah, I mean, I try to. You have to try and look at everything that's going on with someone. And being really reductive with people's care isn't necessarily always helpful. But like you said, the goal of any health practitioner should always be to sort of make yourself obsolete in that person's life, right? Like you want to empower patients and make sure that you're giving them what they want to do back, right? Getting them to full function. And I think this is definitely one of those tools that's very helpful in doing that.
Yes, yeah, it's just, Shockwave gives you the ability now to reach beyond what we can reach as a human just with hands.
Yeah, right. It brings that energy level of what we do up. And I think I joked the other day to you that it's a little bit like having a magic wand. Like it doesn't fix everything, but it's definitely it's a really interesting way to treat patients, and I think a very helpful way as well.
So I have actually a more direct question for you. Like, who would you like to be hero to? Like, what kind of case or condition? Let's say like people in lower back pain, shoulders, or
geez, I actually like treating kind of everything because every case is kind of something new and different. But I do kind of like challenges. Yes. So people who have been in chronic pain for a while, people who have accident injuries that haven't really healed. And I also have a little soft spot for treating concussion.
Yeah. Oh, wow.
I actually took some extended training on concussion management.
Wow.
So I love concussion, and then I find that the cases that I enjoy some of the most in my own practice are just like TMJ.
Oh wow.
Yeah.
Wow. So this is actually pretty unique in a way, because a lot of practitioners focus more on like bigger body part and almost like simpler to treat. Nothing is simple to treat when you go after the cause. Don't get me wrong on that, but concussions and TMJ, it's another level of a treatment and expertise and experience, because they are heavily connected. Like the whole body relies on jaw alignment, like suboccipital area, and that's where pretty much the center of whole balance is. And if that's off, it throws everything off.
Totally. And I think it's that element of challenge for me where I'm like, oh, this is something that's hard, it's interconnected. Don't get me wrong, I'll take an easy low back pain, but you know, it's more fun and more interesting when you can do some of those longer care, complicated cases. It's almost like untying a knot in a shoelace.
Exactly.
You know? It can be frustrating at times. It's going to take you a little bit of time, but gosh, when you get that knot untied and that person gets back to you know, that full better functioning, it's just so rewarding. So I think that's why I like those cases.
Well, so honestly, I'm the same way. And I'm going to share now personal experience, because when I approach every single human that way, my job becomes very interesting and engaging, because I'm not looking anybody the same way. So I'm not doing preset protocols. And I say to every single client, it's like, if it doesn't make sense to me what's happening here, I don't even know how to treat you. And then I treat shoulders in, like, that's kind of my like specialty. And even though sometimes I treat 5-6 shoulder cases a day, none of the calls, it's never the same. So it just, I feel that I'm treating something different constantly. So, and yeah, it's very rewarding that way.
Yeah, shoulder is definitely an interesting one. And you're right. It seems like every shoulder pain is something different. You could see, 10 in a day, and the root cause of every one of those could be something completely different. So I get why you like shoulder.
In a way, it's a condition that has the most of range of motion, in the body, and it has a lot of range of motion, like combined together. But then with Shockwave gives me the ability to actually reach the joint pretty much from any aspect. So, yeah,
it must cut down rehab time as well.
exactly.
There's usually a lot.
Exactly. See, I typically, honestly, I don't see people that are getting better. If they're just hurting for a bit, and they just get massage, acupuncture, adjustment or physio, and that fixes them. I don't see those cases. I only see cases, that like everything kind of failed up to that point. So, but then it also amazes me at the same time how quick it responds as a joint when the right knot, as you said, it kind of released. So yeah,
you pull the right spot. Then it just seems to untie, right? It's crazy.
Yeah, it is. So is there anything special that you're looking forward now, helping people with Shockwave at Unpain Clinic?
Geez, I don't know. This sounds kind of silly, but I think every practitioner kind of keeps a running tally of like wins and losses and draws in terms of the cases you've been able to help people. And I think, I don't know, I'm just a guess, but I'm thinking I'm going to be putting a lot more in the win column, especially some of those chronic ones. So yeah. So I think that'll be cool. But I mean, just even learning a new technique, right? So that's one of those things where it's nerdy, but I like to learn new and different things. And this is something new and kind of different for me. So, yeah.
There's a saying that day that you stop learning, you're actually dead. It sounds very harsh probably, but we constantly learn. We learn from failures, and that's kind of a hard learn, but it's a good learn that we forced to learn. And then the other one is like you get to learn, not you have to learn. So what you just said is like you're that person that you get to learn constantly and change and improve, which is exactly what the world needs. So
I try. I know our regulator sets certain limits that we have to meet every year in terms of credits for continued education. And I will tell you, when I heard that ours were only 24, I was like, what? That's so low. Like every year I'm typically way over that credit limit. So, but again, it's because I get to learn. And I think it's so interesting to be able to, go do a course or go learn something new and bring it back to your patients and say, hey, I found this thing. It's more innovative. It's better than what we're doing. And it's more helpful for you. Like that's the best part of it.
Yes. Very true. Very true. Okay, Dr. Lacina, I think we're gonna end now, because this is not gonna be the first or last podcast episode. In the future, we're probably gonna get together and then kind of dissect a specific condition or injury or case, and we can share actually with people and tell them how we can help. I just want to, anybody who's listening, anybody who knows any person in pain for more than 3 months and have tried everything else, now I'm excited actually to say that we have Dr. Lacina with her amazing experience and approach to help any human in need. And we are good about, if we cannot help you, we tell you we cannot help you, but we know a lot of other practitioners that can actually help people. So it doesn't matter what the case is. We have a free telehealth session that we offer for every client. It's actually online, so you don't have to even come in the clinic. It's 15 minutes. You can book that with Dr. Lacina or any other practitioner at Unpain Clinic, and then we can just kind of guide you and see if you qualify for our treatments. And if you do, we are very happy to help.
Definitely. And we'll send you to the right person if we're not sure or don't think it can help.
Yes, yes, yeah. Hey, thank you. Thank you very much for your time. This was a lovely conversation.
Thank you for having me.
Awesome. Thank you guys. See you till next time. Okay.